You're watching CBS-2 News. Here's the latest at 5:30.
Without 5:30, air quality concerns across the Southland. Smoke from the Northern California wildfires have prompted South Coast Air Quality to issue a smoke advisory through this afternoon. Welcome back to CBS-2 News at 5. I'm Jeff Vaughn.
And I'm Pat Harvey. Now, this is how smoky it was this morning. An orange sunrise greeted early risers, and it made a lot of people wonder if there was a fire in our area.
I thought it was just something around here. I was trying to figure out where is the wind coming from blowing the smoke.
Yeah, he wasn't the only one. Yesterday, the LA Fire Department sent out an alert telling people to stop calling 911 about the smoke because it was coming from Northern and Central California wildfires. Well, the poor air quality may trigger medical problems for some people.
Well, tonight we are joined by pulmonologist Dr. Irfan Khan and the Deputy Executive Officer of the South Coast AQMD, Sarah Reese. They're going to address some of your concerns. And Sarah, first, let's start with you. How bad is the air quality today, and are we through the worst of it?
Sure. So the air quality looks pretty bad, but it's actually good to moderate in most places across our jurisdiction. Some areas in the high deserts, some areas up in the mountains are getting some slightly higher levels where it's unhealthy for sensitive groups. But for the most part, it's in the good to moderate range.
So, Dr. Khan, what are those medical risks of breathing in those fine particles? We know the air quality may not necessarily be the best. Should people be staying indoors if they have certain conditions?
Yeah, exactly. So the small particles, the 2.5 micrometer particles, are the really problematic ones. And as we can see, they're really high looking at the air quality index. Any person who has chronic lung diseases or asthma or allergies, it is strongly advised that they stay indoors as much as possible. If they have, some hiking or picnic trips coming, they should probably postpone it till air quality improves.
Oh, all right. Good to know. Well, Sarah, just how common is it, though, for us to have so much smoke from a fire that's happening hundreds of miles away?
Yeah, so this happens every now and then. We can sometimes get smoke, depending on weather conditions, that can blow in from as far away as Southern Oregon or even Washington State. About a month or so ago, we had smoke from the Southern Oregon fires that blew in similarly to what we're seeing here. When that happens, typically the smoke stays at a pretty high level, so it's not necessarily at the level where we're breathing it in. So that's why the air quality, for the most part, is good to moderate in our area. That smoke is there. We see it as the haze, but it's pretty high up. It's also the reason why we're starting to see some of those impacts in our high mountain communities as well as the high desert, because they're closer to the smoke layer.
Yeah, doctor, it might affect people differently. So some people might choose to stay indoors. What can they do to stay safe indoors and when they venture out as well?
Yeah, if they are going to go out for whatever reason, the best thing is to stay outdoor for as short a period as possible. Wear a mask, wear eyeglasses. Because allergens and pollutants can go into the eyes and cause a lot of irritation as well. And just reduce the amount of time you are outdoors. Early morning is probably the best time to go out. That's when pollution is at the least, most likely. Indoors, people sometimes assume that because they're indoors, the air quality might be better, but it might be not too great either. So using an air quality filter with the HEPA filter is a good thing to do, particularly these days.
Well, we in the Southland, we've been experiencing a bad rap when it comes to air quality and pollution, of course. So I want to ask you, Sarah, does a big smoke plume like what we're having now have a long-term effect on ozone pollution?
So that answer, it's a little complicated, and it depends. As you know, ozone is a chemical. It forms in our atmosphere for the most part. So different chemicals will react under sunlight and form ozone under certain weather conditions. When we get wildfire smoke like what we're seeing today, that can also bring a lot of the chemical building blocks that will form ozone under sunlight. So wildfire smoke can bump up already high ozone levels. But wildfire smoke can also block out the sun. And because ozone forms under the presence of sunlight, it can also sometimes have an effect where it can level off ozone levels or even drop them down a bit. Today we're not really seeing much of a bump from the smoke, so that's good news. But in general, the smoke can increase ozone levels.
So, Dr. Khan, we're all wearing masks, a lot of us inside as well. That's become part of our lives. Does this also help when it comes to the air quality?
Yes, it does. And especially these days, and if the air quality gets even worse, especially if the AQI, the air quality index, goes above 100, which is particularly unhealthy. Then mask use should be strongly advised, and people, especially if you're outdoor, use a mask, not just for the COVID reasons, but for the pollution itself. Mask use has been shown to reduce the number of pollutants that you can inhale, especially the particles.
Before we let you go, for people that have kids in school, like Jeff, just want to ask you, what about them? They are having outdoor recess, and in fact, most of them like to be outside, considering what we've been going through with COVID. What do you suggest?
Yeah, children especially are at high risk for developing problems, respiratory problems from pollution. And again, the same advisory goes for them. The least amount of time they can be outdoor, that's the best. Stay indoors as much as you can, and especially stay hydrated, because the heat and the pollution, the combination of the two is particularly bad for the vulnerable, for the children, for the elderly, for the people with medical problems, especially lung issues.
Well, do you see any sort of long-term effects as a result of this? I'm sorry.
In short term, there are studies which have shown, even a short-term exposure of pollution can cause long-term effects. But if you are otherwise healthy, most likely not. If you have health issues, especially respiratory issues, COPD, then there can be long-term side effects. It really depends on how long the pollution stays, but hopefully this will go away soon, and air quality will improve.
All right. Well, Dr. Irfan Khan and Sarah Reese, we thank you both for being with us this evening. And to see more in